let's move on to our second topic, which is one that is very near and dear to my 30-year-old heart, which is all about prevention. I know a lot of people my age and Misty's age are trying to figure out, what are the little things we can do now to make our lives way easier in the future, because we're millennials and we want everything to be easy in the future. Jenny, can you tell me, what sort of preventative measures we could be doing?
So it's all about your skin, right? You have to keep your skin looking healthy, glowing. You want the integrity of your skin to always be thick. You don't want it to kind of wear off because of all the sun tanning you did. So I always recommend medical grade skincare. You always want to make sure there's a good vitamin C and AHA, which is an alpha hydroxy acid, and retinol in your program, because those are the ingredients that take away the dead skin cells and keep your skin looking glowing. I don't know if you've ever noticed, you're putting on makeup, you're cleansing, and then the next day you're putting on more makeup. It's just a buildup of dead skin cells and, makeup that just clogs your pores. So what the AHA, vitamin C, and the retinol do is it gets deeper into your pores and it cleans it out. You can't really find these products, at Shoppers Drug Mart, just because the ingredients are already done, they're not active. You need something medical grade, just like Miracle 10, what I used for probably over 5 years. And that's where I've seen the difference with my skin. I've seen it glowing, I've seen it clean. I can tell from anybody that's here who's using it or not, because their skin is just really nice and clean, and it's flawless. So that's what I start off with, is skincare, because what's the point of doing Botox and fillers if your skin has sunspots and it's dry and it's not looking fresh? So we start with skincare. The next thing would be chemical peel. So we do dermaplaning with a glycolic or lactic acid on top of that. That again gets even deeper into your pores, really cleans out the skin. A lot of our patients do it on their lunch hour. It's very light, so you can go out that night. You're not peeling there's some aggressive peels out there that where you do have to take a week off work because you're literally peeling and you're red and you're raw. Ours are very nice and light, but it gets the job done. So you can go to work that same day, you can put on light makeup, go out, and your skin's looking really great. People do that every month or every other month. The next thing is when you start to see fine lines that don't go away. So you're seeing the 11s, you're seeing a little bit of fine lines around the eyes. That's when I suggest the Botox. When you start younger, you only need a little bit of units. You don't need a whole lot. So when you do start younger, you're preventing those lines from getting deeper. Other areas are sunspots. So some people, they tanned a lot, in their teens, in their 20s. So now their brown spots are resurfacing, and it's coming out on their forehead, under their eyes. That's where lasers come in. So IPLs. We have a great tattoo removal called Pico-Way that also can take away brown spots. So that's where lasers come in. So not everybody's a candidate for Botox or a laser. Some people might just need a chemical peel. Some people just need maybe filler for their cheeks. Some people just have a brown spot, but everything else is fine. So there's different things that you can do. You don't have to do everything all at once. You do what bothers you the most and what will make you look more fresher and natural in the long run.
So Misty, that sounds like some of the things you were mentioning to us earlier that you have concerns about in terms of your skin. Can you tell us a little bit about that?
Sure. So some of the things that I am noticing in the last couple of years is the stubborn fine lines on my forehead, and as well as the sunspots. I do spend a lot of time in the sun.
I know one of the things that's really weird is, or seems weird, is people say, why does a 28-year-old need Botox? And see, what happens is that your skin folds in the same place all the time. So you have muscles of facial expression, like my forehead. See, every time I lift my forehead, it folds on the same spot. The problem is that if you keep folding your skin on the same spot, you get a permanent crease in your skin. It's like the pleat in my pant. After it's been ironed a few times, it will never come out. It'll never come out. And that's because the pleat is ingrained right into the fabric. Your skin is exactly the same. So when you start off, you're 28 years old and you have 11s, everyone has it because that's a muscle called corrugator that does this all the time. Eventually, that will form a permanent crease in your skin. Or if you smile, if you have blue eyes, the sun bothers you, so you squint when the sun's, and you get these little wrinkles in the corner of your eyes, eventually that's going to cause a permanent crease. So when we put Botox in, we're very careful to weaken the muscle. We're not paralyzing anything. We just weaken the muscle so that you can be talking and have normal expression, but those lines don't crease the skin anymore. It's the only thing we have that actually prevents wrinkles from forming.
So it sounds like a lot of the things we've been talking about, Misty would be a really good candidate for in terms of skincare to take care of those sunspots or sun damage. What can you tell us about sunscreen, though, Dr. Lista? What should we all know about sunscreen?
You should wear sunscreen every day.
Even if it's cloudy?
Even if it's cloudy.
Even if it's snowy?
Yeah, because UV goes right through sun, right? You can get a sunburn on a cloudy day. And it's even worse when you're not getting a sunburn, because if your skin feels hot, then you know you're getting too much sun. But on a cloudy day like today, like right now, the UV is going through, you don't even feel it, so the aging effect is happening without you knowing it. So sunscreen should be like toothpaste. Keep using the dentist analogy. Sunscreen is like toothpaste. It should be buy your thing, and it should be part of your everyday program. And if you don't like the sunscreen you're using, find one that does, like Miracle 10, that's like Cosmetic. But you've got to use sunscreen every day.